Picture this, looking down onto a remote island 100 miles off the west coast of Costa Rica, a biological preserve in an area where the combined wind and current make it always covered with fog. Here, genetic research is conducted. The job before the researchers is to recreate life that's been extinct for millions of years. This scene takes place, of course, in the book, now the movie, called Jurassic Park. It's the fascinating fictional adventure by Harvard Medical School alumnus Michael Crichton. Jurassic Park is the place where ostrich-like dinosaurs sprint through the forest, Tyrannosaurus rex lurks in the vegetation, and hot-blooded baby velociraptors grow like wildfire in a computer-controlled hatchery. In Jurassic Park, dinosaurs are more alive than at any time in the last 65 million years. In case you haven't read the book or seen the movie, I won't give away any more of the story. You can probably guess, however, that such a situation doesn't lead to a love fest. One of the messages of the story seems to be that bringing back something whose time has passed can have disastrous consequences. The breakdown of a system, as it happens in Jurassic Park, can be great fun on paper or on the screen. There's the vicarious thrill when creation runs amok and chaos sets in. But it's no fun when it happens in your community, and it's happening now with healthcare. The great numbers of uninsured people in our society, coupled with the skyrocketing cost of care, make for a system that is rapidly breaking down. Today, I want to talk to you about a few dinosaurs and their characteristics, how the world of dinosaurs changed, how our healthcare system has functioned up until now, and the effect that healthcare reform will have on insurance companies, healthcare providers, and consumers. Now, on to dinosaurs. It would be unfair to use dinosaurs to describe something that's old-fashioned, out of date, useless, or inefficient. It's common to think dinosaurs were big, dull, and headed for extinction because they were poorly designed to cope with the world in which they lived. Nothing could be further from the truth. Dinosaurs were among the most elegant and sophisticated animals the Earth has ever seen, surviving 150 million years. That's 75 times longer than humans have lived on Earth. But changes overtook the dinosaurs. Continents became separated by wide stretches of sea. Sea levels rose, flooding much of the low-lying lands where many types of dinosaurs lived. Instead of it being warm all the time, the climate became more variable or seasonal. Likewise, the healthcare system in the United States was the most elegant, productive, innovative, and effective for its time. But as in the days of the dinosaurs, the climate began to change. Where wide stretches of sea opened in front of the dinosaurs, wide gulfs opened in our own system between the safely insured and those left adrift without the protection of insurance or preventive care. Another great gulf opened between the price of technology and our willingness or ability to pay for it. Where dinosaurs found the climate changing, we find ourselves in a changing world as well. There once was a dinosaur that scientists call the Parksosaurus, but we'll call him the Avoidoriscus. Small plant eaters, they lived in herds. They seemed to have been fast runners, quick to flee the appearance of danger. They stayed alert to danger, careful about the company they kept. This is reminiscent of a few characteristics of insurance companies: risk avoidance, market segmentation, and sticking with large customers to avoid insuring individuals or small businesses. Under the old system, it made perfect sense for insurance companies to protect themselves by refusing to insure the sick, the elderly, people in dangerous or stressful occupations, even though they are the very people who need health insurance the most. Under healthcare reform, individuals and small businesses seeking insurance will be pooled, thereby attaining collective buying power and spreading the risk. The new rules won't allow insurance companies to exclude anyone on the basis of their employment or health status. There will be no pre-existing condition exclusions. Community rating, group health's traditional and preferred method of rating, will be mandated. Standard benefits will be offered to all. The new insurance rules will level the playing field so that all insurers carry their fair share of sicker and riskier people. The Apatosaurus, no, let's make that the Adminosaurus, was a massive creature which weighed more than 6 full-grown elephants. It fed on plants and probably had to spend most of its life eating in order to get enough food for its huge body. This brings to mind the bloated and fragmented payment system. Up to now, outside of managed care, it was most common to find the separation of insurance and healthcare delivery functions. A person would go to the doctor, then submit a claim to a separate insurance company to pay for the care. But the costs of fragmenting the marketplace this way have been tremendous. The United States currently spends 4 times as much on insurance company red tape as on all medical research. The 1,500 insurance companies in this country, with their 1,500 ad campaigns, sales forces, claims processing bureaucracies, payment rules and sets of forms, produce a blizzard of paperwork and administrative costs. Healthcare reform means doing things differently. You will see the rise of integrated health plans, much like group health. This means that a single entity will manage your care and insure you. That is, assume the financial risk for you. Common forms among all providers will mean a streamlined paperwork system. Our third dinosaur is one familiar to all of us. Let's call him the Fee-for-Saurus Rex. More is better seems to have been his slogan. He was both the largest of the flesh-eating dinosaurs and the biggest carnivore ever to live on land. And even though he was 40 feet long, 20 feet tall, and weighed in at 8 tons, he was still capable of short bursts of speed. More is better seems to have been the slogan for the American healthcare system over the past decades, too. Our country's healthcare has been run largely on a fee-for-service basis. In traditional fee-for-service, the incentive for the provider is to create volumes of services. The more that physicians and hospitals do to patients, the more they get paid. As a result, Americans receive the most expensive health care in the world. This perverse incentive promotes unneeded services, procedures, prescriptions, and surgeries. And studies have shown that from 20 to 40% of these services, procedures, prescriptions, and surgeries have little, if any, effect on health outcome. We also get wide variation in outcome. Healthcare reform promotes true managed care, which emphasizes coordination and integration of providers and equipment. The role of true managed care is to keep people well, to keep people who don't belong in the hospital out of the hospital, and to improve the health status of the population. Our state's reform forces healthcare organizations to control costs or else. The organizations that are going to succeed are those that have the lowest costs and the highest quality in services. It's that complex and that simple. It's going to take some time for people to shake the more is better mentality. For a long time, we've been led to believe that more services mean better care, that the more costly the drug or technology is, the better it must be, that unlimited choice is the American way. Under healthcare reform, however, health plans will be paid to manage medical resources and maximize your health. Rather than promote the most expensive treatments, the emphasis will be on most appropriate services for the particular patient. The most appropriate services will be determined by research into outcomes, research that tells us what has worked best. The goals of healthcare reform are good, but make no mistake, it will be tough to achieve them. Our fourth dinosaur has center stage in the Jurassic Park movie. It's the one that multiplies like crazy. Let's call him Preventoraptor, constructed to be fierce and agile. When it needed something, it went after it with stunning speed. That go-get-it-now attitude has characterized healthcare consumers for a long time. We've all been educated into a throwaway mentality, inundated with advertising preaching convenience, no waiting, you deserve the best. People smoke, drink, indulge in all manner of carelessness, then expect to be cured when something goes wrong. Tragically, there has been little emphasis on the prevention of illness. Our country is still rife with the expectation that every ailment can be fixed, and the fee-for-service system has traditionally focused on acute care. Yet most people, chief among them the elderly, suffer from chronic conditions. What these people have, whether it's high blood pressure, diabetes, or emphysema, can't be cured, yet we pour most of our resources into looking for cures. For the greatest good, our focus needs to be on the management of chronic medical conditions. Healthcare reform does this. Through managed care, it promotes wellness with comprehensive and preventive care for all. You will see the community's focus begin to shift from diagnose and treat to predict and manage. Healthcare reform also intends to provide readily available, unbiased, usable data on performance, quality, service, and customer satisfaction so that you can compare available healthcare plans. Healthcare reform hopes to foster a citizenry that is educated about and involved in its healthcare. Well, there's my assessment of what healthcare reform is meant to do. Certainly, dinosaurs predate our human efforts by a fantastic amount of time. But for as long as people have existed, they've been trying to heal their ills. People have been engaged in the laying on of hands longer than they've been raising animals, using the wheel, baking bread, using written languages, or working with metals. Healing is an ancient business. But like everything else, it has to change its form when the world changes. The dinosaurs are gone. We can't reconstruct the past and bring back the old ways. People are no longer content to rely on the powers of incense or song, and our problems are becoming more intense. That's where healthcare reform comes in. As our population continues to grow, the groups growing the fastest are the most dependent on tax-based programs like school-aged children, Medicaid and basic health plan participants, immigrants, and the elderly. Businesses, whether they are small, medium, or large, carry a huge but invisible burden. Through their health care dues, they pay for the uninsured. Because in this country, uninsured or not, you still get care. But it's in emergency rooms and hospitals with latent diagnoses and lack of follow-up treatment. This ultimately costs us all so much more than if we had a universal system of care for all. Also, as we look into the future, it's hard to deny that social pathologies will result in more disease and injury. Drug misuse, alcoholism, violence, poverty, homelessness, and other ills will strain public health resources. I think healthcare reform is a statement that we are willing to move toward a common goal to reduce the impact and burden of illness on the American people. Part of the great American dream is health care that is immediate, convenient, perfect, and paid for by someone else. What we're feeling now in this country is the pain of waking up from that dream. Our best hope is to fundamentally restructure the delivery system so that it pays all of us to behave in the public interest. The way reform will work is if we all give up something. Employers will ultimately have to accept paying health care premiums for their full-time employees or paying a tax. Employees will have to accept paying a part of their premiums and point-of-service fees. Both will have to accept a limit on what's tax deductible. Doctors will have to learn new skills. Administrators and executives will have to take less income. Insurers will have to learn how to manage risk instead of running around trying to avoid it. If any of us insist on putting an invisible shield around ourselves and expect that we won't have to change under healthcare reform, we will find ourselves mistaken and overwhelmed. Now, before the passage of Washington State healthcare reform, I used to tell this story. On a plane bound for Europe, the pilot's voice came over the public address system, and he said, "Ladies and gentlemen, I have two pieces of news for you. One of them is good and one of them is not so good. The bad news is that we are hopelessly lost and I don't have any idea where we are. But as I told you, there's good news too. The good news is that we have a 200-mile-an-hour tailwind and we're making great time." For us, there is good news too. Because of healthcare reform, we are no longer lost.